Thank you so much for being with us today, Dr. Rementer. So we've heard of hip replacement, knee replacement, but you can do ankle replacements now. That's amazing.
Yeah.
How are they better or different than an ankle fusion?
So ankle replacements have been around actually since the 70s, but we haven't gotten really good at them until the last couple decades, really in the 90s when they got better, and really in the past 10 to 15 years when we got the really good technology. By replacing a major joint in our body, it's always better than fusing it because it allows the motion to be there that is naturally there, and that puts less pressure on the joints around the ankle. So then you don't have adjacent joint arthritis or wear and tear of the joints that are next to the ankle joint.
Oh, that makes sense. Who's a candidate?
So good candidates for ankle replacements are people with end-stage ankle arthritis, usually after traumas, whether they broke their ankle or have chronic sprains of their ankle. Usually the patients are people who want to keep motion in their ankle but are not looking to be super active because you can't run afterwards. And
I was going to ask about athlete.
Yeah, and you can't jump and move around on it, but you can still walk around and you are able to perform more sedentary athletic activities like golf and tennis with braces. But if you're looking to be mobile, really running and jumping on this, you're more looking at the ankle fusion until you're living more of a sedentary
And then you
lifestyle.
switch from the fusion to the replacement. Yeah. So talk a little bit about the surgery and the process.
So the surgery itself is an outpatient surgery for the most part.
Outpatient?
So people can go home the same day.
Wow.
We sometimes keep them overnight to help with pain, but otherwise what's different from an ankle replacement from a knee and hip is you're actually not starting physical therapy until 3 weeks after surgery. Our incision's on the front of the ankle. We go in and we actually resect out the joint surface of the ankle. We take out the bottom of the tibia and the top of the talus, which is the bone that goes up into the ankle joint. And then inside that, we go in and we replace the bony surfaces with metal and replace what is normally cartilage with a piece of plastic called polyethylene that allows the two pieces of metal to grind smoothly on each other while you have the motion.
That's amazing that you can do that. Now, is this an actual piece of ankle replacement that you use?
This is the same technology, but it's a model. So this is actually plastic instead of metal of what we use.
Okay.
But yes, so we go in the day of surgery. It usually takes about 2 hours. We go in there, fix any deformities that we need to do, and then replace the joint, and then close you up and able to do a nice block so that you don't have much pain afterwards. And if your pain's decent, then that's when you can go home. What's different with an ankle replacement than a knee and hip replacement is because there are incisions on the front of the ankle, when you bend your ankle, it actually tries to gap the incision and causes risk for it to not heal. So for the first 3 weeks, we actually don't put any weight on your ankle until the incision's fully healed. Once the incision's healed, then we get you moving and going pretty quickly in physical therapy and actually out of a boot and in sneakers by the 6 week after surgery with your new ankle.
6 weeks after.
Mm-hmm.
So then you're doing your rehab, and how long till you're pretty much back to where you can be back to as close to normal as possible?
So with any major surgery, we always say it can take up to a year to get to your full recovery, but usually around the 3-month mark is where we're looking at you functioning pretty well in about 75 to 85% of what I expect you to be.
Now, how long does an ankle replacement last?
So right now, the new generation of implants are lasting about 12 to 15 years if the patient is handling them appropriately and not putting too much wear on them. And usually the part that wears out is the plastic piece that is the insert in between the two metals. But we're still researching the newer implants that have only been out there for about 5 years now, so we're hopeful that we can get further and further out with those ankles just like we're able with knees and hips now.
So you had an interesting statistic about the weight on your ankle, which is fascinating.
Yeah, so every step you take, unlike your knee and hip, your body pressure through your ankle joint is actually 150% of your body weight. So it's what makes
percent. That's amazing.
Yeah, it's what makes replacing your ankle joint so much more difficult than your hip and knee. There's a much smaller surface area for that weight to be distributed, and it's different type of cartilage that's normally there. So we have to try to figure out how to make it last longer to take all that wear.
Because the knee and the hip then don't take as much weight and they last longer.
Exactly.
So interesting. Dr. Mentor, thank you so much for your time.
Of course.